let's do some shadow work together. This one's a bit of a big one. The nursing shadow wound and what it creates in us. And I will tell you, there's a lot of conscious people in nursing and in medicine in general. Nurses in particular, I see a lot of neurodynamic brains in the nursing profession and in the support staff professions as well. Anywhere where you're in a healing profession, giving of yourself. Now for this video, I'm just going to talk about it as the nursing shadow, but as I was mentioning, it can be really across the gamut of helper professions, and you'll see a lot of really neurodynamic brains and a lot of conscious brains. We create a shadow of unworthiness, a shadow of not being seen, the shadow of we're basically always been underpaid. You certainly don't go into nursing or support work for the pay, for the gratitude, or for being seen by your employers or being seen by your government. We can see that now. So these people are going into it because they really genuinely care about people. And this is why I think we have a lot of neurodynamic brains in healthcare, especially in those ones that are truly in there for the care part of it. And this is where we have to be careful, because neurodynamic brains are really impressionable too, and they've been through a lot already in their growing up phases, and they equate a lot of this helping with their self-worth and their self-love and their value in themselves. And being in a career that has constantly been undervalued, underpaid, underseen, never asked really for their opinion, in places where we have really amazing things to say that could help the system, you develop these shadows around yourself, especially when you're working around doctors all the time. I'm not going to go after the physicians in this one, but there was a post I did a couple summers ago. You can go back and find it. I think I had it pinned. I will repin it if I didn't, but that explains exactly where that shadow is created by medicine in particular, because we are virtually non-existent in their worlds in the medical landscape. Don't ask them questions. Don't ask too many questions. Don't talk too much. Don't take up too much of their time. Heck, I've even had some doctors just be absolutely appalled that I even wanted to talk to them in the first place. But that's what we were trying to do, is provide safe care. And that was always a place I thought where safety was a huge risk factor in this dynamic that was created. Getting back to just how nurses are treated, for a lifetime. I'm sure in Canada for sure. We definitely feel it here. Probably in the United States. I have many nurse colleagues that live across the border, and nurse safety has been a big issue in providing safe care. Like, our safety has always been underneath that of anybody else. We were expected to be taking all the hits, the punches, sometimes literal ones, and in always an effort to protect patients. That was never anything that was considered for us. So if you can see now where the value systems get placed on this nursing wound, or this nursing shadow, or this support staff shadow, our own employers and our own people who govern this don't care enough about us to provide safe working conditions. They never have. And I don't know if they ever will, to be quite honest. So you multiply that by a 25 to 30-year career, you can see where a lot of this shadow development, this one's a big one. And so if you are awakening and you have been in these kind of areas of work, consider what that messaging has brought to your value of yourself, because you've lived it year in, day out, year in, year out, for decades, and it takes its toll. I unpacked that one last summer, I think, and that was a big and powerful one because the whole part of awakening and reclaiming your sovereignty and your freedom is to reclaim yourself and your self-worth and your self-love and your self-esteem, and to remove all that self-doubt, because a lot of that gets created in us just from the experiences. Even though we're very intuitive nurses, but half the time our intuition isn't even valued either. So if you are one of those neurodynamics who were in the healthcare system a long time and are in your awakening journey, this is just a seed to plant that I'm planting for you to, do some shadow work on. Go back and replace that puzzle piece that was missing in the very beginning, where you didn't feel like you were valued right from day one. And know that it wasn't a part of you. It was a part of something that was created for you. Now you can bring that forward in a really healthy, positive way and say, no, that wasn't mine to manage. And now I need to know where it came from, let it go, make peace with it, and make better decisions going forward, and knowing that my self-esteem and self-worth was always the top priority and should have always been. And I didn't get a chance then, but I get a chance to undo that programming now. We certainly have a lot of nurses in the awakening journey, a lot of healthcare aides, a lot of support staff of all kinds, a lot of people working in different areas of healthcare support that need to hear this and know that you have always been valuable, you have always been worthy, you were always deserving of that respect and that protection from the people that should have protected you. And I'm here to tell you that. And a tiny little bit to add to it is that this really, it applies to any kind of support staff position, especially it really depends on the type of employer you're working for. Because in my career, providing therapeutic support to people, I've seen more unhealthy employers than I do see healthy employers, which is why we really want to give this conscious commerce a try, because conscious commerce not only creates a very healthy environment for people in the workplace, but this is the kind of environment that will provide a positive psychology, self-worth, self-love, value systems in your staff that follows them home after work, to their families, to their friends, to the everything. So there really is an important reason why we want to kind of re-look at how we do business these days. And I know healthcare isn't a business, although some will tell you, yes, it's very much a business. I'm staying away from that conspiracy right now, but you know what I mean. Love you.